Episode of the Wild Strength Podcast, where we talk about all things wild and all things strength and everything in between. Today, my guest is Dr. Preston Ward from Mountain Physio, and his walk-up song is Midnight Rider's Prayer by Brothers Osborne.
Whoa.
That's a good song, though.
Yeah, like I said, my guest is Dr. Preston Ward. I'll let you kind of introduce yourself a little bit, and then we'll get into things.
Thank you. Thanks, Whitney, for having me on. That's a good song. If you're going hunting, that's a great song. Anything Brothers Osborne is a great hunting song. So anyways, but yeah, I appreciate that. My name's, like Whitney said, Dr. Preston Ward. I'm from Salt Lake, so I grew up here. Oh man, I grew up in Salt Lake, lived here my whole life, hunting from a young age. Married, have a young daughter as well, and so we like to enjoy the time in the outdoors. What else? Got a couple dogs, a couple bird dogs, so I love bird hunting. We were just last week, we were on a conservation snow goose hunt in South Dakota. So I love all things archery hunting, bow hunting, but there's also a part of me that I really loves all bird hunting and everything else like that. And so started bird hunting when I was young. Back then, you could bird hunt before you could big game hunt. And so did a lot of bird hunting. And so anyways, love that. I went to school at the University of Utah, so graduated with my doctorate there. And then about 5 years ago, a little over 5 years ago, the fun story is I was at an archery shop, and I had just graduated, did my residency, did the whole thing, was getting a new bow set up, overheard someone start complaining about shoulder pain, and they said, the guy turned to his friend, they were just having a conversation. I guess I was overhearing this conversation, eavesdropping, and they said, the one turned to his buddy and said, I'm going to have to give up archery hunting. I'm going to have to give up bow hunting. The surgeon said I need surgery, that I might be able to go shoot a crossbow, but other than that, I probably will have to give up all sorts of bow hunting. And for me, that just kind of struck a chord that I was like, gosh, there needs to be someone out there doing something, some healthcare for bow hunters. I always have thought that hunting is a sport. And so especially bow hunting, we all know that it's how strenuous it can be. So I started up my practice, and for 5 years we've been going strong and have a lot of cool, exciting things in the making right now. But yeah, that's basically the background of me.
That's super cool. I don't know if I had ever told you this before. My background is as a strength and conditioning coach, and I see the value in it, but I have even injured my shoulder and specifically my draw arm before, and instinctually was go to PT for that. And of course, I think, yes, you go to any normal physical therapist and they're going to take you through normal shoulder rehab. And then I tell them I shoot bows, I do archery, whatever. And then they try to at least the one that I went to was trying to simulate the draw movement pattern and all of that. And I don't actually know your thoughts on that, but I kind of have the mindset of and even in sport too, no specific movement can simulate exactly what you're doing, but you want to try and build up the musculature around that. Is that kind of your thought as well?
Yeah, absolutely. I always tell people, people say, what's the best exercise for strengthening to be shooting a bow? Well, ultimately it's shooting your bow, sport specific training. And so that's where it is important to have a therapist, or, that's why we've started up our clinic, is to not only give sport-specific drills, so I can grab a TheraBand and pull back and draw back and simulate it pretty good, but ultimately it's getting people back to shooting. And what that sometimes looks like, it's not just also turn the limb bolts and crank it down as low as you can. It's also a matter of how many reps you shoot. And so what I do is specific arrow dosing, I call it, where if you're rehabbing from an injury, it's how many arrows you're shooting per week. And so one cool thing, I work with the U.S. archery team. I travel with them, which is really fun. But these guys are shooting sometimes 600, 700, 800 arrows a week, right? Yeah. A lot of arrows. Now, no one really should go and do that unless you've been doing that for years. I know that you probably shoot every day. I shoot every day, but I'm not shooting that many. And so arrow dosing is really important so that you don't hurt your shoulder, basically. So anyways, arrow dosing, giving the right exercises, all sorts of things, but getting people back to shooting 100%. So.
Yeah, I think that's arrow dosing is a really good like word to use or phrase around all of that. And ultimately, like my injury was an overuse injury, and
Mm-hmm.
I had tweaked it a little bit in training, but then had just gotten a new bow, new draw cycle,
Yep.
had upped the poundage, and was shooting a crap ton because TAC was the next week after I had gotten my
Yeah.
bow. So I wanted to make sure I was all dialed in, and yeah, ultimately it just was an overuse injury where I got to the point where I couldn't even draw my bow back. I with PT, I actually picked up a recurve and like a
Mm-hmm.
little trad bow and would just pull back like a 20-pound bow because I didn't want to drop my compound bow all the way down. And just even just to like draw back and hold like that helped me a ton. Do you, yeah, I know people probably come and asking for like specific exercises, but do you still try to encourage, and maybe it's just dependent on the severity of the injury, some degree of shooting, or do you just kind of recommend like no shooting at all until you're feeling better?
That's a great question. It just depends on severity of injury or what's going on. So the way that I practice is, so I've been practicing therapy, gosh, for 8, almost 9 years. Like I said, been working at the university, the VA, other systems. Had my practice for 5 now. And the way that I've always practiced it is I never like to take away something that's good or a sport from someone, especially if it's encouraging activity
Mhm.
or exercise.
Yeah.
All activity or exercise is going to be better than sitting on the couch and being a couch potato, both mentally, physically, everything. And so I don't take it away unless I know that that is the one thing that's causing the issue. And I say take away, like put some restrictions on patients of just people who come to me and they're like, yeah, it does hurt when I'm shooting. Okay, well maybe let's maybe think about this arrow dosing component. Hey, maybe let's dial the poundage back. But I really like to not take that away. I like to add to people's programs first before I take away. So, anyways, yeah,
Yeah, I think that's really good because I think a lot of, at least in my experience, physical therapists' first instinct is to take away, right?
yeah,
Like you are experiencing pain in this, so take it away. And actually, funny, I was gonna like start asking you a question, which I think after maybe this conversation, I know the answer is like as a strength coach, I've worked with two type of physical therapists. One are the ones who are like just if you have an injury, and specifically it usually is along like low back injuries and deadlifts, like you should never do that again, that's going to make
yeah,
it worse. Or I've worked with physical therapists who, exactly like you said, are yes, maybe a deadlift does not feel great on your low back right now, but if we do it properly and we adjust the load and the intensity, we can even strengthen your back and make your back stronger. So
yeah,
yeah, I was actually going to start asking you like which kind of physical therapist are you, but I guess I kind of got
yeah,
that from that answer.
yeah. Yeah, I'm definitely the latter. And I think I love talking about deadlifts just because I really do love deadlift as an
Hmm.
exercise. And people who are listening to this who have back pain are probably thinking like, oh man, that hurts, or I heard a pop when I was deadlifting something once. But really deadlifts are so good. And so I work with a lot of patients. Some of my specialty other than orthopedics is a lot of chronic pain. So
Hmm.
pain management, and people like really the statistics show. I just read an article a few maybe a month or two ago that said 85% of people will now have back pain in their life, and really deadlifting, like getting back to those activities that cause some. So that's the type of PT I am. Like and I think that's kind of like you're saying, there's two different
Hmm.
types.
Yeah.
I'm kind of like the latter, like you said, where if you're having an issue with that, then we're going to do everything we can to get you back to doing that, because both physically it's good, but also if we think about pain and chronic pain, it's actually more like mentally and cognitively, that's better for you as well to get back to those things. And that's what overcomes a lot of this chronic pain stuff, is the psychological part. So more to it than just fitness and exercise, or there's a lot of mental strength and rehab that I go through as well. So anyways.
I think that's huge. And I guess kind of next question, as far as like what you do with Mountain Physio, I know probably most people think of it as shoulder stuff for shooting, but you think of what a mountain backcountry hunt looks like. There's load carriage and that affects your hips, your back. So do you have people that are coming to you for that kind of stuff as well?
I do, yeah. We have, I mean, it's been fun. I've been able to see people all over the country. We do a lot of virtual stuff, a lot of virtual
Nice.
coaching.
Uh-huh.
So a lot of virtual health coaching, and yeah, when I think about the hunter, so Mountain Physio specifically, like I said, I was in the archery shop, kind of geared it towards being hunters and bow hunters, but we see everything, all outdoorsmen, trail runners, have a
Mhm.
handful of clients here locally who've had spinal cord injuries, strokes, so a lot of adaptive stuff. So really kind of everything. But for the hunter specifically, it's all sorts of usually shoulder pain, knee pain, back pain, ankle stuff, and so kind of
So
the whole spectrum really. So my specialty is I'm a board certified specialist in orthopedics. That was what I did my residency in, and that's what I got my board certification in. And so apart from when people say, "What's your specialty?" It must be shoulders because you work with archers. I'm like, yeah, it is, but really, it's everything from the head to the toes,
yeah.
and it's not just rehab either. It's a lot of prevention. A lot of people are coming to me because they want to better themselves and prepare for a hunt, and so they may not have a lot of pain, but they want to do the injury prevention sort of things, and they want to prepare themselves better. And so we're doing a lot of training that way. And so that's pretty fun. Health coaching that way.
Something that I love hearing that because I think more, and maybe I think things are definitely changing, not even just like in the hunting world but in the training world altogether. Like people are wanting to take more of a preventative approach with their training versus like I'm just going to go balls to the wall, and if I get hurt then I'll figure it out after the fact. I see more and more people even just going to a local gym, or maybe even I see it on Instagram, who are doing that preventative prehab is what I like to call it type stuff. So
Yeah.
it's really cool to know that people are coming to you for that as well, because I think, yeah, most people see it as like, oh, I don't need a doctor until I'm sick. I don't need a physical
Yeah.
therapist until I'm hurt or until I'm injured. And that's how we hunt for the rest of our lives if we take that
Yeah.
preventative approach versus waiting till it's too late.
Yeah. That's always been, Whitney, my kind of motto is, and more recently, because we've launched some kind of a new platform, is basically the longevity game, hunting for life, right? So I've had a lot of clients, which is super fun to see. The amount of new hunters is pretty wild to see. Like I said, I've been hunting my whole life, and it used to be something that we just hunted in October for the deer hunt for a weekend, and then that was kind of all we did. And now hunting, as you and I know, is becoming 365 days. It's a passion that we have that people are just trying to get out. And so I've had a lot of clients, actually, a handful of them that are in their 60s. Some even actually one gentleman I'm thinking of last year who came to me in his 70s. I think he was 74 or so,
Oh yeah.
and he was going on an archery bow hunt at the age of 74. He had never hunted. He had never hunted. He had never bow hunted elk before, and so he lived here locally. He came into me and we started working together. And he's like, I'm having a little bit of pain when I'm drawing back, and so he was having little aches and pains, which is normal as we age, but at the same time, it was just really cool to see that this gentleman who was, 74 years old, and we're seeing a lot more of those people who are 60 years old, 65 years old, that want to continue to do this sport and enjoy it. And I think a lot of it's probably because their kids are starting
Mm.
to get into a lot of bow hunting, and so they want their dad to go with them or their mom to go with them or anything like that. And it's just it's really cool to see to me. So anyways, it's been fun.
Yeah, I've noticed something similar, and just whether it's just and one of the older gentlemen I've met at the bow shop, or just any just man who has kids that I've met who hunts, they're like, well, I obviously want to be able to not only teach my kids how to hunt, but when they're old enough to hunt, go with them for as long as I possibly can. And I think sometimes it takes them having kids to realize that. Like there are
Yeah.
some guys I know who are older and don't have kids, and they don't think that way. So they do just kind of, like I said, go balls to the wall and do as much as they can. And that is like, I hate that for most people because it sucks when you get to that point when you can't do things anymore.
Yeah.
Whether it's you can't draw your bow back anymore and you're shooting a crossbow, and there's nothing wrong with that, right? But when that's not what you want to do, that kind of sucks. Or I was having a conversation with someone this past weekend, and he was talking about, like, he's relatively young too, in his like early 20s, and was talking about how terrible his knees are, and he's like, I don't know like how long I'm going to be able to be climbing mountains anymore. And I'm like, you're in your early 20s, dude. Like, you
Yeah.
can you can get better. Like, things can get better from here. It's not too late.
Yeah. Yeah, so that's where, and I love that topic and just thought, because you're absolutely right. When I hear that too, and the thing that makes me cringe the very most is when people are young like that, in their 20s, 30s, doesn't matter how old, actually, 40, 50,
Yeah.
and they go somewhere to sometimes to another provider, someone who's looking at their imaging or their surgeon or anything like that, and they're like, oh man, you have the worst knees I've ever seen, or you have the knees of a 60-year-old and you're 20 years old. Automatically, right there, what that's doing to the brain is
Mm-hmm.
completely shutting it off from being able to go and do those activities. You're automatically limiting yourself. And so, even if you had some arthritis, like, we know that arthritis isn't necessarily the limiting factor in a lot of cases,
Yeah.
that you can have some narrowing of the joint but not have pain. And so, I hate when I hear that, and I cringe when I hear that, or when people say, you should never shoot your bow again, or you'll never do that again, or you'll never hike again, or a young 20-year-old who's like, I've got the worst knees, I'm never going to be able to do this again. Like, there's so much education that has to be given to that individual. And that's where I've really kind of taken, again, our practice and this platform is like more, I feel like my calling is this role model here in the
Yeah.
hunting world, is to be that person that educates and gives that good information, because even like the littlest misinformation can cause a lot of harm, mentally, physically, all sorts of things. So, anyways, kind of a very interesting topic. But yeah, that's one of the reasons why I started this practice, was to kind of get on that soapbox at times, to say,
Mm-hmm.
let me really tell you actually the good evidence that's out there, that exists, versus sometimes hearing from other people and sometimes influencers and things like that are like, oh, you draw your bow here, it hurts here, that means you have, this is wrong with you. And I'm like, well, that's not always the case, actually, and we should really be careful about doing that. So anyways, that's kind of a fun little tangent there, but it is really important to get very good information. So
Yeah, no,
yeah.
I would definitely agree. And I might even go down that tangent just a little bit more because, like, a personal interest of mine as well. I was going to ask you about the Mountain Physio Academy next, but we'll move that to after this one.
Yeah.
So, yeah, and I even know, like, I'm currently working on my PhD, and my research is in like stress and
Awesome.
stress physiology. And similar with stress, we know like what the effect that the mind, even just telling yourself things, can have on the stress that you
Mm-hmm.
experience, and ultimately pain that you're experiencing is a stressor as well. And so, like you had mentioned, even just telling yourself whether you can't do that again, then automatically your body is like, you're right, I can't do that. Or you're telling yourself that it hurts, and then your body's going to keep thinking, like, yep, this hurts. And I've even read a little bit in like pain science and pain research that, like, with
Mm-hmm.
chronic pain, the more you're thinking about chronic pain, the more it's going to hurt and it's never going to go away. Versus if you're working with maybe a physical therapist or a coach or a trainer or whomever, like you are, who is of the mindset, like, I want you to continue doing what you're doing, and you have more of like a positive mindset around it and a you can mindset around it, that totally changes the pain experience that you have.
Yeah, yeah, I love this topic, which I haven't brought up a lot on a lot of podcasts. And so this is really fun because
Yeah.
um, the pain neuroscience, PNE, pain neuroscience education is huge. And we have so much data to support that. Again, the reason why a lot of individuals who have persistent pain, chronic pain, is because of the mindset, the way that they are thinking. And not only that, it's kind of, there's a model called the biopsychosocial model,
Mm-hmm.
which is looking at obviously their biology, so anatomy and those sorts of things. But we know that, like, a lot of data supports that people who have a great example is back pain. 85% of people have back pain. Some have herniated discs and things, but a lot of times those herniated discs, they reabsorb, but they still appear herniated on imaging, but they're not symptomatic. Or meniscus tears is a great thing. A lot of them are asymptomatic, and so people have something once and they say, oh man, that's got to be the reason.
Mm.
Well, even imaging, so the biology and then the psychology, obviously that mental game and really kind of reframing the way that you're thinking about things,
Yeah.
and then the social aspect of it too. Anyone who has kids can relate to this, or anyone in general who nieces, nephews, anything like that. If they see someone and that toddler or that child falls down, scrapes their knee, immediately they look back to their parents for,
A
am
reaction.
I okay? A reaction, exactly. Am I okay? And then you'll see parents, oh, you're okay, get up, and then they get up and they run off, right? Or they may cry a second and then they get off. But if you coddled them and you said, oh my gosh, come here, well, that ultimately feels good for human nature to be coddled and to be loved like that. And
Mhm.
so what it does is it breeds this kind of feedback loop. And so a super fascinating study when people are having chronic pain in general, that it's important to do, for me, a thorough assessment and really evaluate the whole picture. And then a lot of times it's going into like, hey, let's start adding this component, a deadlift. Let's start adding that deadlift into there. Let's start adding a lot of these things, changing up the psychology, changing up that social aspect, get you into a community like the hunting community where you're out and you're going on hikes and you're doing those sorts of things. So what a fascinating topic, honestly.
Yeah, I could go for hours. And kind of like I
Yeah.
said, the like pain ultimately is a stressor, and you bring up like the social aspect of it too, and kind of big things that I harp on is one, like when you're around, I mean there's that like cliche quote of like you're the combination of like the five closest people in your life or whatever. And so when you're around like positive people and encouraging people, like no matter what stress or pain you're experiencing, they're going to tell you like you can keep on, you and encourage you, and they're going to tell you to keep doing better. And you're going to get to a point where you're like, shoulder pain, what is shoulder pain?
Yeah.
And then also when you like with stress in general, like kind of the whole mindset thing, when optimize like the stress mindset is kind of how I like to say it, as far as when we tell ourselves that like what we're going through is hard, it's going to be physically, mentally hard. But if we change our mindset to like that's a growth mindset, is kind of what it's referenced
Mm-hmm.
as in the literature, is like, man, if I can get better from this isn't as hard as I think that it is, or this hard thing is good for me, I can grow from this, then that completely changes the experience that we have. And yeah, I think I could go forever about this, and I think it's really cool to talk about it. And I just wanted to expand a little bit because I know most people don't know that. And they
Yeah.
don't know about like the neuroscience side of things of pain. So that was really cool to
Yep.
talk about. Um,
Yeah, for sure.
I did want to talk about, I kind of mentioned the Mountain Physio Academy before we dove into that a little bit. What exactly is that? What was your goal with that? And then, like, if that's something people are interested in, like, what can they kind of expect from that?
Yeah, no, thank you. Yeah, we're really excited about the academy. So you can find it at mountainphysioacademy.com. I'll throw that out there. But what it is, so my ultimate goal with that, we've been working on it for about 2 years now, a little actually over 2 years now. So actually a much larger undertaking than I ever imagined. So what it is it's an educational platform, and I call it a healthcare platform because there's a lot of training programs out there right now, and there's nothing wrong with those. Like great, training programs out there. There's a dozen companies out there. You
Mm-hmm.
can find anything on the internet like that, and they're good. But the difference is that a lot of those are, here's some exercises to do, and we have that certainly built into what we're doing. But the difference is the educational piece of really, again, that longevity. And so a healthcare platform, because with every membership to the academy, they get a one-on-one health assessment. I call it like a yearly physical with me, or some of my providers that work for us. And so every year they're going to get a physical therapy screen, or every time they have that subscription. And ultimately, the reason why that's important, Whitney, is because tailoring programs is always better than having these kind of general programs for people. Again, there's nothing wrong with it. There's a lot of good exercises out there. At the end of the day, there's only so many exercises that can be done because there's
Yeah.
that only that so many exercises. How you do it, how you dose it, periodization, all sorts of things are really important within that. And so the whole goal with the academy was to educate people, to build a platform for health for individuals.
Mm-hmm.
So it's been awesome to do. Like the response has been great. There's a lot of people super excited. There's a lot of people running through it right now,
Mm-hmm.
getting good results. The whole idea was to have it be very evidence based, and so when people go through, they subscribe to the educational platform. Then they receive an email for our app that's more the health, or more, I should say, the exercise side of things as well. So there's kind of two apps involved with it, and they go through the platform, and as they go through, the whole program is to get people ready for the mountain, basically, and so or the outdoors or anything like that. So there's a lot of content in there, a lot of videos. Actually, when we were adding up videos, there's actually over 160
Wow.
videos,
Mm-hmm.
each ranging from anywhere from 2 minutes to 10 minutes.
Okay.
So actually just way more work than I thought it was going to be again. But at the end of the day,
Yeah.
really good information, because it talks to people about, if you're having back pain or if you want to prevent back pain, these are the exercises to do. And then goes through different body regions. The coolest part about it, though, which people have been super excited, which has yet to be done in the hunting industry, I must say. So I'm really excited to be really kind of the pioneer of this, which is providing, I should say, objective data. So like a scoring system to see how you measure up for hunting or preparedness. And now these aren't just tests like go put on a pack and go hike, and call it good, or put on a pack and jump up, do some stairs and then go shoot your bow and, call that good and stuff. Those are great, but talking about the anatomy, the physiology. So it is a very analytical system, like people who are analytical, who like to learn the science, the why. If they're kind of diving into I think we're all gear junkies in the hunting world, but if they're really diving into like, why is this tent better than this tent? Then this is a great platform, because at the end of the day, I'm explaining like, this is why you do this exercise, and this is why it pertains to you as a hunter. And this is not only just exercise, but also rehab, recovery. So a lot of the things that are specific to physical therapists, so educating that way. And then at the end of the day, it takes 5 different components, and it gives you a score so that you could say, you go through this entire scoring platform, Whitney, and you're like, hey, shoot, sweet, I'm at, at 90%. I'm 90% ready for the mountains. Or maybe you're like, shoot, I'm only at 60%. Then it gives you somewhere to start to say, I know I need to focus on this. I know I need to focus on this. And that's why after they meet with me and we do that health assessment. And so way more than just exercise, lots of mobility stuff, cardiovascular, strengthening, mindset, the mental aspect is in there, nutrition's in there, a whole bunch of things. So it's a really cool, I'm super passionate about it, because it's A, took a lot of work, but B, is just like the amount of information there is so much that it's such a great value for people. And that, again, I have yet to be seen. It hasn't been done. There's a lot of, like I said, training programs. There's even new ones coming out all the time we see, which are good. They have their part, but I think taking it to that next level is what we've done with the Academy. So pretty cool. Yeah, check it out. I'd appreciate it. You can subscribe and get a small little PDF, but ideally subscribing to it where you can get the full app and the full experience is what you got to do.
Yeah, I think that's awesome. And a couple of things you mentioned there I want to hit on. One, you kind of mentioned the concept of like individualization for whether it's just a prehab type program or a training program or whatever that looks like. So many of these apps that exist, and like you said, there's nothing wrong with it. Some people, that's what they like. And at the end of the day, like as a coach, for me, if you like what you're doing, that's what's going to keep you doing it, right? So I don't want you to find a program that you don't like because I said it's what's good for you, and then you don't do it because you don't like it. So at the end of the day, it's just what the person likes. But like you said, I think a lot of these apps are like, here's a one size fits all program approach, and one size doesn't fit all. we look at not even just hunters, but like everyone in the world. And not
Yeah.
everyone is one size. Everyone moves a little bit differently. We're all built incredibly differently. And I always like every body, like literally every single body is different. And so we have different needs. And whether that is just to get stronger, whether that's to build endurance, whether that's mobility, different people, maybe two people have back pain, but their back pain are for two very different reasons. So
Yep.
they need two very different preventative or training exercises to get their back pain to go away. But most apps, like I said, do have that one size fits all. So I think that's really cool that you have taken the approach and given people the opportunity to get something that is catered specifically to their needs, because that's not often that that happens.
Yeah, it like I said, it's a lot of work, but it's cool because we got a team of therapists willing to and ready, just ready to help people. And so we're staying busy, and that's really exciting. And sometimes even sometimes too busy, but
I
it's really good because we're seeing that people really want that not only tailored approach, which so we're doing a ton of one-on-one health coaching, and those are options as they're on the website that can find the one-on-one health coaching for a year, and so monthly check-ins and things like that. Really cool things, and just trying to really tailor it to people and their needs. And then, like I said, yeah, the academy is all part of that, and it's just it's a cool platform. It's a different platform.
Mhm.
Like I said, at the end of the day, there's a lot of exercises in there. There's so many exercises you can do to just build the quads and stuff like that. And so
Yeah.
ultimately what I've done is I've tried to really pull from the data, like this is why we're doing this exercise, because it has the highest EMG value.
Mhm.
So really pulling in. And so honestly, in the in the plat on the platform, I've listed all the references so that if people really want to go and read those articles, and it's like there's like over 100 articles that
Mhm.
people can just gather and read for themselves if they want to. Now I know not everyone wants to do that, but it is a pretty cool. It's a cool platform. I will say that it is neat. There's been a lot of excitement. We've had a lot of, and there's even actually more benefits to it. Working with a ton of other companies, and I was up at Kafaru. That was a big thing. Baku. So there's a
Yeah.
bunch of companies that are part of this, that are seeing the value that this has to hunters and the longevity game. And that's ultimately what this is. Like if you want to do some preventative stuff, it's a great platform. If you're trying to rehab, it's a great platform. But overall, like if you're wanting to hunt for your lifespan,
Yeah.
it's the platform for you, because it's going to educate you on what you're going to do when you do have back pain, or when you are in the mountain, you need to, tape up your shoulder, or all sorts of things
Yeah,
like that.
yeah.
So,
I appreciate the educational component of it too, right? Because like I'm not talking crap on any other apps or platforms, but once again, it is just the program itself. And so then you have like I'm a huge nerd. I nerd out on a lot of
yeah.
things, and ultimately, like why I like coaching is I like to educate, right? My favorite part of coaching is when someone says, "Coach, why are we doing this?" I'm like, "Oh, yes." Like, let me tell you
Yeah.
why. Let me tell you the purpose of it. Let me tell you why it's going to benefit you. Because every exercise that I've ever chosen for anyone has a purpose. I didn't just go on Google, type in exercises to get you stronger, and then put the first five exercises that came down. Like, I take and choose every single exercise for a specific reason. And so I think that's really cool that it sounds like you've done something similar where people are very aware of why the exercise is there, why it is that exercise that you recommended, and even so much has gone as far to include articles in there. And like you said, maybe some people don't want to go and nerd out on research articles, but I sure as hell would.
Yeah. It really is a cool library of exercises, and just, or not just exercises, geez, a library of articles and stuff. And that's why I really like, so from a pricing standpoint, I don't love to talk about price, but from a pricing standpoint, it is
Yeah,
priced higher than
for sure.
a typical training platform,
Mm-hmm.
because ultimately it should be, because it is healthcare dialed specifically for outdoorsmen, hunters, athletes, but also that extra component of education, the one-on-one visit. And so there's other perks with other companies, like tons of different uh, advantages of it. And so it is priced a little bit higher, but at the end of the day, like it
You get what
honestly
you
should
pay
be even
for.
priced. It should be even priced higher, but exactly, you get what you pay for. So
Yeah, no, that's awesome. And so, what kind of like you? It's like a training program and exercises. Is it more based on like the rehab side of things, or are you actually building out like training programs for people as well?
building out training programs as well.
Okay.
So a lot of the building out training programs. There's a lot of when people. So it's so the master class is a 14-week course. When they subscribe, there's a 14-week course. They get that app. They actually have the app for 365 days. So they have it for a year, and every day they're having a new workout. And so they get 365 days of programming, all the different programs and stuff that I run people through. So if you want to increase your draw strength, like that's one program in there for 6-8 weeks. We're going to do that. So a lot of different things, a lot of different built out programs that way.
Yeah.
Then if they want to have that one-on-one visit, they can meet with me and we can tailor it a little bit to them as well. So that's where we take the tailorization, I guess, customization. And so I am building that out, but the 14-week is kind of a standard program that it takes you through. I think the reason why I did that is I kind of had to start somewhere with it, some sort of, here's a platform, here are the exercises that I like, and then customize it and then kind of continue to build that. And most people really like that. They really do like the kind of like, give me a program for 6 weeks, give me a program for 8 weeks.
A
And so
year long
that
program
is,
is hard to stick to.
yeah. And so that's why I've kind of done like these little chunks in
Hmm.
there. So it's been fun to see, like it's been cool. We have a handful, like I said, of people right now that are coming to the end of it. We launched it at the Hunt Expo in February.
Oh yeah.
And so we've been working on it for years, and we kind of just like, this is the time to do it. And so we launched it, and it's been really well received, which has been really exciting. And there's definitely been some feedback. I'm not going to say that it's 100% perfect, because it's not. And but I know that it was either now or
Or
never,
never.
because it would
Yeah.
never be perfect.
Yeah.
And so there's some things that I'm constantly tweaking, and that's the cool thing, is it's a course that's, again, it's a course that's ever evolving, and there's some little nuances from the app and all sorts of things, programs and stuff that I'm changing. But at the end of the day, the educational piece and the course itself, that's what it was going to be originally. It was just a educational piece and platform that way. But people wanted more, and so I was able to come up with this app and kind of help them that way, and it actually works really well together. But anyways, it was just going to be that, but the educational piece and the platform and the one-on-one visit with myself or my team, one of my team members, is really like the bread and butter of this. And not only that, I guess I should say also we call it the Mountain Fit Readiness Score. So the MFRS is what it's called.
Mm-hmm.
Again, a 25 kind of question, 25 tests or assessments built into that. So an algorithm, I could call it, to see how people measure up. And so that's a really cool system, again, that I have yet to be seen, that says, if you can do this, and if you can, and again, these aren't tests that I've just kind of pulled out of thin air and be like, oh yeah, I think that would be good for hunting. They're like really data driven tests that we know that if people meet, for one example, if they meet, for their age and their gender, if they have VO2 max of this, then they're doing pretty good. And so looking at all sorts of things. So
You said the Mountain Fitness Readiness Score is what it's called, right? I'm big also into like testing and assessments, and I feel like before you do any program, you need to know where you're at so that you know that it's an effective program, and you need to know that you're actually getting things out of the program that you're doing. And I know you kind of mentioned you have like tried and true, like tested things that are in there. What kind of, if you don't mind me asking, what goes into that readiness score?
yeah, so there's 25, I guess, 25 tests, we'll say.
Mm-hmm.
So one of them is looking at the mental strength, and there's a big questionnaire and stuff. So looking at the mental strength. Another factor is, so we know that so one example is, it's a test called the Bering-Sorensen test. And ultimately what it is you lay on your stomach with your hips on the table. So your trunk from basically your hips towards your head is suspended in the air. And so you hold that position. And if you can hold that position for a certain period of time, then the incidence of low back pain goes down significantly for the next year. And so using data like that, data-driven tests, objective tests. You and I test a lot of people. I test a lot of people in the physical therapy side of things, of having that data, because that's what ultimately insurance companies love to see.
Yes.
I don't do a lot of insurance stuff anymore. But when I was working at these clinics, they like to see that data. I still like to see that data and see people improving, and people like to see it too. And so those are a couple examples of some of those tests that are in there. Tests pulled from data, tests pulled from research, from good randomized studies, and things like that, to really good systematic reviews to make sure that we're doing it the right way.
Yeah, I think that's awesome. And yeah, I think I've seen other readiness test or like beginner test on, I'm not going to call out names of an app, but just there's different ones that I've seen. So there's multiple where the assessment itself was either not something that could be like valid and reliable and reusable, or it was something that, like, in my opinion, and I'm sure you might agree, like all assessments, like, or an assessment should not count anyone out, right? Like there
Mm-hmm.
shouldn't be a movement, there shouldn't be a test or whatever as an assessment that someone cannot do, no matter their physical level or functional level or mental level, because then at that point, this is now not an all-inclusive assessment and it only
Yeah.
is geared towards specific people. So I've just seen assessments in the past too where, like, if you weren't tremendously fit already, you could not do that assessment that they had, or if you couldn't like bear some sort of load, you could not do that assessment. And it sounds like the ones that you've chosen, like you said, are either in the research or ones that you use in work, and are ones that, like, no matter where you're at, whether you are in rock bottom and cannot move or in all kinds of pain, or whether you feel great and you're taking a preventative approach, that like everyone can do these assessments.
Yeah. Yeah. And so another great example and I have a couple of thoughts I want to hit on, but another great example is a deadlift. Deadlift's on there.
Mm-hmm.
So trying to get your max deadlift. We know that deadlifting is really probably a good activity to do if you're a hunter,
Mm-hmm.
so that you can pack out your meat, pack out the quarters, get into the backcountry and stuff like that, right? So there's some good data from a strength and conditioning coach or perspective, right? That you need to be at a certain percentage. And so having those numbers in there is important, but then enough mobility from a PT standpoint of things that you want to look for. So yeah, that has been a kind of been a challenge, is when people have been going through this course, is like some people want more, other people want less. Some people are only able to do 30 minutes. Some people are only able to do 20 minutes. And I'm okay with people doing, like, a lot of these programs are sometimes built out for 30 to 45 minutes of exercise, or 60 minutes. And like, that's sometimes too much for people. But ultimately, like, trying to tailor it to everyone has been so hard. With, like, going back to the, here's a plan for everyone. It's been so hard to do. And I hate that I have one, but I kind of needed to say, this is kind of the beginning, like, start with this stuff and then let's tailor it, because that's the whole idea is,
Yeah.
and if they want to do that, at the very beginning, they can do that. If they want to wait till the 14th week, if they want to wait till 6 months, if they want to wait 2 months before their hunt and they kind of want to tailor it, they can do it all sorts of times. And then they can obviously purchase other evaluations and assessments and stuff like that. But at the end of the day, like, it's kind of it's a really big challenge to navigate people's health that way, and their overall exercise capacity. So yeah, they do these tests, and ultimately, if they don't meet that value, then yeah, that affects their overall score. But it just, to me, it tells me, hey, I know for me right now, I had a lot of changes in my life recently, actually, where was working at another job as well, and actually just quit that job and now doing full-time Mountain Physio and the Academy, which I'm super pumped about. Like,
Nice. Yeah.
it's actually been a big thing. I'm going to have do a lot of different things, and so kind of exciting. But ultimately, my health was really being put on the back burner. Like, so I know that if I was to go do some of those things at deadlift right now, like, I wouldn't be able to. My score would not be as high as I know that it should be for hunting. And ultimately, the last few years, I've seen that affect me with my ability to get into the backcountry. Like, I am more winded than I should be. I am struggling more with, XYZ. And so that's why I call this even a more of a, again, more than a fitness app or anything else like that, or a fitness program. is it's a healthcare program, a healthcare platform because of all the education, the assessment certainly, but also just diving even further into, hey, let's do our evaluation. What medications are you taking? This is how it's going to affect you. What is your nutrition like? What are you eating? Um, what's your blood pressure like? What your cardiovascular risk factors? Have you smoked? All sorts of things. And so that's built into the program so that we can, again, have an entire comprehensive healthcare program for people. And
Mm-hmm.
so that's why I'm like, I love this topic. I love, super passionate about it, obviously, because again, I don't see that happening, and it needs to be. I was actually, this is kind of a cool story. I was at the Hunt Expo when we launched this, and some gentlemen came up to me, two different occasions actually, and one of them was in his like maybe mid 40s. Another one gentleman was probably in his late 50s. Both of them had multiple stents placed in their heart, and they're like, I can't do a max deadlift. I can't, because ultimately my surgeon said, be very careful doing that, because if you do a Valsalva and you could rupture that, and so ultimately, like, there are some heart considerations that we need to take into it. And so if everyone's just going and doing a general exercise program, it can be good. It's probably good for you to exercise, but that might be the one thing that does it puts you over the edge, right? And so having that provider, having, someone like myself, one of my other doctors, to really assess that
Mm-hmm.
is super, in my eyes, critical for every hunter getting out there in the outdoors, especially if you're starting to age and have some of those comorbidities.
Yeah, I think that's for those that are listening. He mentioned the Valsalva, which is basically when you hold your breath to tighten your core as you do an exercise, and when you do that, that increases your heart rate, increases the rate of blood moving to your heart, which if you have a heart stent can be an issue. But like you said, that kind of goes back to the first thing that you were saying early on was they had a doctor ultimately tell them that they couldn't do those things, and kind of to the like neuroscience of it that we were talking about as well. They were
Yeah.
told, like, no longer are you able to do these things. You shouldn't try these things. And obviously, to a degree, the doctor is correct, right? Like, that person should not go after the doctor says that and try to max out their deadlift.
Right.
But they can work up to that. And with a qualified practitioner like yourself, who is able to work with them through those things on an individual level, like, they can get back to deadlifting. Now, they might not be able to get back to maybe where they were when they were younger or anything like that. But like we talked about earlier, I don't think that there's ever anything that should be taken away, and they
Yeah.
can certainly get to a degree of functioning that the doctor maybe said that they couldn't do.
Yeah. Yeah. And that's, I mean, and again, that's the whole premise of this entire academy, of my practice, is really making sure, again, teaching people what they need to do for life. So
Mhm.
that longevity piece, so many hunters, as we go back to, as we were talking, like, so many hunters want to continue to do this for life. And I don't think we should put a number on that person who wants to be shooting their bow. There was actually a cool thing here in the United States that it was like someone at the age of, I think it might have been I'm gonna get it wrong, but anyways, she or he was like 100 years old, shooting a bow, and it's it's not it's not out of the question, I think. Now, to what extent does that look like? Who knows? But I'm not gonna be the one to say you can't do that or you shouldn't do that. I'm gonna be
For
the one
sure.
that says, let's work with you,
Mhm.
and let's see exactly.
No, I think that's super cool. And yeah, there's so many people. Appreciate you have the longevity approach, and that's even for me, whether I'm talking about training, whether I'm talking about stress, whether I'm talking, I work a lot with like tactical populations as well, so
Yeah.
military specifically, but police and fire as well. And even in their careers, like, it is notorious that they retire and then maybe 2 3 years later they pass away because they were so stressed throughout their career. So
Yeah.
not only do we want you to have longevity in your career and be able to last the length of your career, but also once you retire, you have 20 30 40 more years after you retire to keep doing the things that you like to do. And same thing like you're talking about here in hunting, like, you don't want to yeah, maybe you're lucky, and like you said, you've been hunting all your life, or there's someone like me who I've only been hunting for 3 or 4 years now, where like if you've done it all your life, maybe you feel like you're 25 and you're like, I've done all the cool things, so it doesn't matter anymore. But you still have so many years ahead of you, and there's so many more cool
Yeah,
things that you can do. And to be able to, like you said, to hunt for literally forever, I think is every
yeah,
hunter's dream.
yeah. I think that's what we're seeing is there's so much. I think we all have. Oh, sorry. I have so much love and passion for the outdoors in general that I actually just gave a presentation on this just a couple days ago for a California physical therapy board, and it was kind of funny because some of the questions afterwards were like, "So you're a hunter? Like, is it ethical to do this and that?" And I'm like, "Oh gosh, we're going down." Anyways, it
Oh
was kind of a
gosh.
fun population to talk to. But
Uh,
whether it's hunting or not, we all have a love for the outdoors. Everyone's probably listening to this. Um, and in general, we have a responsibility, a social responsibility to protect the outdoors, but also I think to kind of rear up our children in the outdoors, and we love that. And so, whether it's hunting or it's just getting outdoors or being active with your family, like that's the big message. And I've just found it. I guess that I've been lucky enough to really kind of land here in Salt Lake, where there's this huge hunting population and individuals and community, and then be able to take it to a platform where I saw something was missing and built something for a global, to have a global effect. And so it's been fun to really see that. And I think ultimately that's my goal is longevity for just being outside and enjoying it. Whether you're hunting, hopefully that's the goal. But if it's not, then maybe it's just being active with your family and going on a hike and enjoying the peace and nature, the peace of nature and stuff like that.
cool. You kind of include like all of the outdoors, and even not just the physical component that the outdoors has on your health, but the mental component as well. Like you just know in the research we see that being outdoors is great for your mental health. So to even encourage, and I think early on you had mentioned you work with like some trail runners and some hikers. So I think that's cool that I guess good on you to be mountain physio, because mountain can be all inclusive of a lot of things versus being
Yeah.
like the hunter physical therapist or hunter physio,
Right.
because then you honestly cut out a large number of people
Yeah.
who aren't hunters, because then they're like, well shoot, what do I need to do to go, or why would I go to a physical therapist who specializes
Yeah.
in hunting when I don't hunt? So
Yeah.
it's kind of cool that you kind of get all of those populations as well.
Yeah. Thank you. Yeah. It's been fun. It's been a fun process, fun journey. Like I said, way more work at times than it probably should have been. And it still is so much. People that say they're like, oh yeah, that'd be fun. I want to go do that too. I'm like, good luck. It is so much work. I have put in like 80, 90 hours a week at
I
times
bet,
putting
yeah.
into, it's been a lot, but it's fun. I'm not going to say it's not worth it. I love what I do. I love the patients that I see. I feel like every time I get to talk to someone, every day I'm just super lucky, blessed to be able to do that because um, I love working with this population. I love working with the hunters, talking about stories, talking about their next
Mm,
adventure, their next hunt. It's super fun. Been a lot of work, but it's good, and we're still growing, and so that's exciting to see too.
and that's what starting any business, right? Like I think if you speak to any entrepreneur who started anything, they have the 80, 90 hour weeks, but at the end of the day they're like, I wouldn't trade that for a thing, because
Yeah,
they're like you mentioned, so passionate about what they're doing. And then especially you who is passionate about the education side of things, like if one person, and I always said this approach, like even as a coach, like if I have one person, and whether it's the group that I'm working with or if I'm presenting and there's one person in the audience who takes something away from what I taught them, and then they go and tell someone else, and then that person goes and tells someone else, and then it like spreads like wildfire after that. And that's the cool part about education to
yeah,
me. And then, yeah, I think if people are a part of your program or experience the academy or whatever, any of the things that you have to offer, and they benefit from that, then that's how your business spreads, because they have a positive
yeah,
benefit from that. And I think, yeah, you've taken such like an incredible approach to this versus and a very broad approach, so it's inclusive of a lot of people. It's very individualized, which a lot of people don't recognize how important that is as well. And so
yeah,
I think that'll go very far, very fast, hopefully.
yeah, yeah. Me too. Definitely subscribe.
Yeah, for sure.
Subscribe. Reach out to me. Let's set up an appointment. I do a lot of that stuff, virtual appointments. Again, just kind of yeah, make a connection that way. And so, but yeah, definitely check out the Academy, subscribe, and sign up for an appointment.
That would be awesome. Preston, I end every episode asking my guest, what does wild strength mean to you? You can take it quite literally, or just maybe what comes to mind when you think of wild strength, kind of a play on the name of the podcast. But with that, I asked you, what does wild strength mean to you?
Yeah, great question. I think for me, maybe just from being this last discussion we had, but it's, I think it's longevity. I think that's a great term right there. I think I've hung out with Dan Staten a lot and, or a few times I should say, really a good friend of mine. Um, he uses the term limitless. I would
Mhm.
say, healthcare longevity. I think that's kind of what wild strength means is being able to be strong for life, I guess I'm going to say, and not just strong, but like mentally strong, physically strong, all sorts of things that way, and making sure that we're doing it for life. So I think that's where I'm going to say that. I think that sounds good.
I'm slightly biased, but that's probably my favorite answer because I am such like so big on like longevity and training for
Yeah,
life, and now that I'm into hunting and the outdoors, like being able to do that for life as well. So biased, but my favorite answer for sure. Where
nice.
can people find you if they have any questions, if they want to ask you anything? And then I know you kind of, I think you said earlier on like what the website was for the academy, but if you kind of want to
Yeah,
mention that again.
yeah. Best way to get a hold of me is my website. So that is, I've got two: www.mountainphysio.com. That's MTNPHYSIO. So mountainphysio.com. Then the Academy is a great place too. So if people want to go schedule one-on-one visits, personal visits, and stuff like that, they can also purchase the Academy on that website. Then they can send an email to me, kind of a request if they want me to. So people reach out quite often on there, say, hey, I have a shoulder issue. Could you kind of look into it? Yeah, let's schedule an appointment. So anyways, there's that, mountainphysio.com. Mountainphysioacademy.com is, again, the new academy that we have. I definitely recommend everyone checking that out. There's trial programs, there's free stuff on there. You can go through and see kind of the outline of the course. You can look at the different options, the one-on-one health coaching, a lot of different options there. And then after that, let's do some social media. So it's Mountain MTN underscore physio. That's my handle on Instagram. Pretty active on there. People can reach out, message me. A lot of people do that quite often of say, hey, can we set up an appointment? And I think you can even go on and click a link in there and schedule an appointment with me. Facebook, YouTube, kind of the same thing, same links and stuff like that. Going to be doing a lot more YouTube videos. There's some cool hunting videos on my YouTube channel of me shooting a
Nice.
buffalo, so that was cool. My
Nice.
wife's buffalo, that's going on there here soon. Some antelope hunting, so different hunts, but also just different educational pieces on what the academy is, kind of a little bit of lifestyle of my lifestyle, but then also how-tos for drawing, shooting, exercises, warm-ups, all sorts of things. So a lot of stuff on there, and that's growing as well. So that's how I'd say reach out to me. Send me an email for sure. You can click those links on my Instagram handle, everything else like that. Send me messages. Do it on the website, but get a hold of me. I'm happy to answer any questions. If I don't have the answer, I'm happy to refer you to someone who does have the answer. So make sure that people are getting taken care of.